Now, for more on the concerns over the J&J vaccine and its implications, I'm joined by Will Humble, Executive Director of the Arizona Public Health Association. Thank you for joining me.
My pleasure.
Now, as we know, it's been about a week since the official pause in the U.S. What's the latest word from the CDC and other regulatory bodies in the U.S.?
Well, it's been actually pretty quiet for the last few days. The CDC and their advisory committee for immunization practices has put together a 5 or 6 hour agenda for Friday. That's this week, for an in-depth review both of the risks, which you've talked about, those 6 cases, and perhaps there's a couple more we don't know, but also importantly, the benefits of the Johnson & Johnson vaccine. And that was a missing piece of the discussion last week. So I'm pleased to see that the advisory committee this coming week will actually be looking at benefits, unique populations that the Johnson & Johnson vaccine is successful getting into, which is lower income parts of the U.S., and not just these very rare events, as you just heard about, as it's similar to cases but identified in Europe.
So then, with these 6 rare cases that really did set off alarm bells for a lot of people, what more do we know about the people who reported those blood clots after the vaccine?
Well, one thing we know for sure is each 6 of them got the wrong treatment. And it's not any clinician's fault. It's not any doctor's fault. It's that there wasn't enough information at the clinical level to understand what the best treatment is for these blood clots. And so one reason that the FDA and CDC suspended the Johnson & Johnson vaccine temporarily in the U.S. is so that doctors could better understand how to treat these clots. And the 6 persons that we know of, 5 of which are women, all got the wrong treatment. And so we're hoping that word gets out, and that if there are, and probably when there are future clots, that they will get better treatment and have better outcomes. Only one of the 6 passed away. The rest are still alive.
So then, was the decision to pull the vaccine the right one? And what's happening with the investigation so far?
Yeah, that's the question. That's the big question for Friday. In my opinion, they made the right call to temporarily stop distribution. And now the vaccine is still under emergency authorization. I mean, clinicians can still use it. It's not forbidden. They're just recommending that it not be used right now. Now, I agreed with that temporarily, but I'm really hoping that both the CDC and the FDA and their advisory committee take the track that Europe is taking, honestly, which is to provide more disclosure, make some additional announcements within the packet, but reauthorize or re-recommend a use of the vaccine, because the other 2 vaccines we have in the U.S., those messenger RNA vaccines, have a very strict cold chain requirement. And just as is the case in the developing world with Johnson & Johnson and AstraZeneca, we need certain kinds of vaccines in the U.S. to get into our underprivileged and populations, because it's harder to, for example, get vaccinations into farm workers with that messenger RNA vaccine that has such stringent frozen cold chain requirements.
So to that point then, talk about the impact of having one less vaccine, especially in lower income countries that really were hoping this one-shot, easier to store option would be more widely used.
Well, there's 2 things. Within the U.S., it has big implications because I mentioned persons that are homeless, persons that work in farms. That type of demographic is really, the Johnson & Johnson is absolutely the best way to get those folks vaccinated. One thing I'm really concerned about in the U.S. is that if this advisory committee decides to keep Johnson & Johnson suspended, and if they make that kind of recommendation, my concern is that there are many developing countries that will look at that decision and get afraid and create more vaccine hesitancy in the developing world, in some of those lower income countries that are participating in the COVAX program. And we can't afford that. We can't afford that kind of fear amongst other countries, especially when we are talking about extremely rare events that were identified here in the U.S.
So then, in terms of solutions, are other vaccine producers able to fill the gap left by Johnson & Johnson, and have they improved some of the production losses that they had to take with the 15 million that had to be discarded?
Yeah, so in the U.S., yes, the production of the Moderna and the Pfizer vaccines, those are the other 2 authorized vaccines, have ramped up markedly. And we are seeing good success in wealthier and middle-class persons in getting that vaccine out. Where we are falling short in the U.S. is in our lower income areas, unique populations. I mentioned farm workers and others that really the Johnson & Johnson is unique. It's uniquely useful to getting into those populations, just as it will be in much of Latin America, South America, Central America, Africa, and other parts of Asia. We need vaccines like AstraZeneca and Johnson & Johnson because they are so much more flexible than the Pfizer and Moderna vaccines that require really stringent cold chain requirements.
Indeed. Well, thank you for your insights. Will Humble there, Executive Director of the Arizona Public Health Association.
My pleasure.